Hey everyone, if you're working with a patient that has lateral epicondylitis or tennis elbow pain or this pain on the outside of the elbow, and you need a few things that you can do, you don't have a long time to spend working with this patient doing these types of things because maybe you're working more on functional mobility or dressing tasks or these other things. And so I'm going to show you a few things that you can do to try to improve this pain and symptoms that they're having out here so you can carry on with the rest of your program. The first thing we're going to do is use a dumbbell. Make sure it's a really light dumbbell to start with. I'm going to prop my forearm up on this half bolster. You can take a towel roll, roll it up, put it just like that in front of them, and they're going to pull their wrist back and try to hold that maybe 2 to 3 seconds and then slowly lower that down. And they're going to pull it back, try to hold that 2 to 3 seconds, and then slowly lower it down. They should feel that on the outside of the forearm over here where they're having pain. It's normal for the patient to have pain. I don't expect a patient with a tendinopathy issue to have no pain while they're going through their movement. So just, reassure them that this is normal to have pain in this area while we're going through these movements. I'd repeat that for 1 to 2 sets of 10 to 12 repetitions. Then we're going to flip over and go into wrist flexion. Now, I know that the issue is happening out here on the outside of the elbow. So you say, why would we work on the inside? Well, number one, a lot of times grip strength is compromised because of pain and inflammation out here. The other thing is I'm going to use this exercise as also an assisted stretch. So instead of just taking my patient's hand and wrist and bringing it down like this and stretching it, which you can do that and that's fine, I'm going to incorporate it into the exercise. So I'm going to prop my forearm up here. I'm going to come back and I'm going into wrist flexion. So I'm pulling my wrist back. And when I come back, I'm really going to feel this on the inside over here, the opposite side of where all my pain is. I'm going to feel on the inside here in this flexor mass. Then what I'm going to do is I'm going to take my hand and apply a little additional stretch to the patient at the end. And they're going to go back down. And they come back up. They're going to hold that for just a second or two. And I'm going to apply a little stretch. And they're going to feel that come down the back side of their forearm. So that's like a strengthening exercise with an assisted stretch at the end. I like to stretch this way because as we're activating these wrist flexors, this flexor mass group on this side, because the opposite side has to relax. Those are known as antagonists in this situation. They perform the opposite movement. So the wrist flexors are bringing the wrist up, and the wrist extensors bring the wrist back or the hand back. So what I'm doing is by contracting this side, I'm relaxing this side and then applying that additional stretch. It just makes a really nice stretch that's also time saving because again, I realize you don't have a lot of time to spend going over this because there's a lot of other things that you need to get accomplished in your treatment session. Now we're going to go over to using this band. So what I'm trying to do is expand my fingers or extend my fingers like this. I'm going to put this around. You can use a small band like this or you can just use any type of TheraTubing or TheraBand. I'm going to put it around here and I'm going to work on bringing my fingers out. And I'd complete this for 1 to 2 sets, even working up to 2 to 3 sets of 10 to 12 repetitions. Again, the patient should feel this on the outside of their forearm here in this extensor mass area. Then we're going to use one of these grip strengthening tools. It doesn't really matter what kind you use. Any kind is fine. And again, you're just going to kind of work this 2 to 3 sets, 10 to 12 repetitions. You're going to really feel this on this flexor mass side here. And we just want a resistance with this. It's not too much, it's something that's comfortable. They are going to feel this on the back side. This, again, a lot of times grip strength is compromised with tennis elbow or, this lateral epicondylitis or epicondylalgia that's going on out here. And so that's not uncommon to have that. Just reassure them again, pain is normal while you're going through this program. Lastly, we're going to use a tennis ball. Now I select a tennis ball because it has a broader surface area versus maybe just using your thumb or using one of those scraping tools because a lot of patients, if they're in a long-term care facility, maybe even in a hospital, they've got a lot of medical things going on. We don't know the skin integrity here. We don't know whether I'm drawing blood or these different injections and things that are going on. So we want to be careful in this area. And you just use a tennis ball, you go right over the painful area and you just hold pressure. And sometimes I make little circles with it. I'm not pressing really hard. A lot of patients will say this is kind of that hurts so good kind of a thing. Just pressing in, I'll go clockwise, maybe counterclockwise, just kind of all over and just kind of work my way down. Again, I'm keeping contact with the tennis ball on my skin. So I'm not scraping this on the skin, so I don't want to irritate this area. I'm just going with pressure and just kind of working the whole area. And that does really well. And I spend maybe 30 to 60 seconds, maybe even 2 minutes as the patient says, that's really feeling pretty good with a tennis ball in that area. I hope these tips help guys to try to decrease that pain and symptoms that your patients have on the outside of the elbow here, as well as improve their strength and their grip and their wrist. in order to be able to continue with their overall functional program within the rehabilitation. Thanks for watching.